Welcome to the Biology of Meaning mini-series, video 18 on the topic of massive iatrogenesis and medical silence, when treatment can also cause illness. Modern medicine has saved lives, but it has also harmed others. There is a topic rarely discussed in healthcare, iatrogenesis. It occurs when a medical treatment harms the patient. It can result from adverse drug effects, unnecessary procedures, incorrect diagnoses, or excessive medical interventions. This is not about demonizing medicine, but understanding a complex reality. When the healthcare system loses balance, care itself can become a risk. Western medicine and the problem of iatrogenesis. Scientific medicine has recognized iatrogenesis for decades. It appears in many forms: adverse drug reactions, hospital-acquired infections, surgical complications, and unnecessary treatments. This does not arise from the individual malice of physicians. Often it results from structural problems, systemic pressure, lack of time to listen to patients, rigid protocols prioritized over individual experience, and overspecialization without communication between disciplines. When care becomes too technical, automated, and fragmented, the patient may be reduced to a clinical case expected to follow prescriptions while individual needs are ignored. Psychological dimension of silence. In many healthcare systems, it is difficult to speak openly about medical errors. Professionals may fear sanctions, institutional pressure, or lawsuits. This creates what is known as medical silence. Yet, acknowledging errors is essential for improving healthcare. Medical ethics are strengthened through transparency. Biology of meaning and illness. From the perspective of the biology of meaning, the symptom is a signal expressing biological and adaptive processes of the organism. When treatment focuses only on eliminating the symptom without understanding its context or meaning, excessive interventions may occur. This does not mean rejecting medicine, but broadening the clinical perspective. Understanding the symptom before intervening can prevent many iatrogenic events. Neg and biological responses. The physician Reich Gerd-Hamer proposed that certain biological processes activate in response to intense conflicts experienced by the organism. Despite controversies surrounding this theory, it opened an important debate. Could the organism possess biological processes with adaptive purpose? Ignoring this question entirely risks intervening without understanding the body's logic. Jung and the meaning of the symptom. For Carl Jung, symptoms may carry symbolic meaning within psychic life. Body and psyche are deeply connected. When medicine ignores this dimension, treatment may remain incomplete. Understanding the psychological dimension of suffering is essential in care. Wilber and the integral vision. Philosopher Ken Wilber proposes understanding reality through multiple dimensions. His four-quadrant model shows that health involves body, mind, culture, and social systems. When medicine focuses exclusively on the biological body, blind spots appear. Iatrogenesis may arise from this narrowing of the clinical perspective. Level of consciousness and the therapeutic relationship. One of the least discussed aspects of iatrogenesis concerns the level of consciousness present in the therapeutic relationship. Modern medicine has developed enormous technical capacity, but has often neglected the human quality of the clinical encounter. Ken Wilber reminds us that human systems also evolve through levels of consciousness. When healthcare systems operate at low levels of awareness, troubling patterns may appear: professional arrogance, inability to accept criticism, vertical communication, and invisibility of the patient's experience. In such conditions, the therapeutic relationship becomes unequal. The patient remains passive, often without time to ask questions or participate in decisions. When ethical principles are broken. Classical medical ethics is based on clear universal principles: beneficence, non-maleficence, autonomy, and justice. In situations of iatrogenesis, these principles may be compromised. Patients may feel uninformed, ignored, and unable to question medical decisions. When they attempt to complain, they often face institutional systems that protect the structure more than the patient, generating distrust. Biology of meaning and the patient's experience. Human suffering cannot be reduced to a simple technical error. Feeling ignored or mistreated by the healthcare system can become a profound emotional shock. True care, therefore, requires listening, respect, dialogue, and clinical humility. Traditional Chinese medicine. Traditional Chinese medicine views symptoms as signs of energetic imbalance. The goal of treatment is not merely to eliminate the manifestation but to restore harmony within the organism. Medical Taoism. Medical Taoism teaches a simple principle: intervene only when necessary. The wise first observe the nature of the process before acting. When medicine becomes excessively interventionist, it may move away from this principle of balance. Pharaoh Proposal. The Pharaoh model proposes integrating multiple dimensions in healthcare. Before intervening, it seeks to understand the biological process, the patient's emotional history, life context, social factors, and psychological dimension. This approach reduces unnecessary interventions and aims to humanize and expand medicine. Pharaoh Thought. Humility in medicine. Medicine needs science, but it also needs humility. Recognizing limits, accepting mistakes, and listening to the patient does not weaken medical authority, it strengthens it. Healthcare professions exist to protect life, and care begins by recognizing the dignity of the other. Learning Beacon. Modern medicine possesses extraordinary tools, yet no health system is perfect. Recognizing iatrogenesis does not weaken medicine, it strengthens it. True scientific progress requires self-criticism and ethical awareness. Real medicine is defined not only by technology, but by its capacity to care for human beings with science, awareness, and humility. The best medicine is not the one that intervenes the most, but the one that understands best. Science heals when accompanied by awareness. Without awareness, even medicine can harm. Learning about health is a collective responsibility. Learn science with awareness because in health, knowledge is not neutral. Knowledge is vital. If you find this content interesting, subscribe to the channel, leave a comment, like this video, and share it. For those who wish to explore further, study with ESSI, Pharaoh, a training program designed to understand health from an integrative perspective of body, mind, and consciousness.